Renegade, man when afraid man in the wilderness. Keep it real and honest, you know, tablet. Good afternoon, good evening, good night, good morning, worldwide. The renegade there. I tell you, man, forget a long sleep. Well, me sleep for so long, cause the time I'm going to my bed, you know. Wow. All right, so people, hear this. Christopher Tufton, you know, easy, you know. You know, easy. You know, so the box stop with you. Last week, you met the doctor, them, I forgot on strike. And the result of that, the hospital them no good none at all. So it result like the young miss, the teenager, dying child's birth, and many more. And you know it stop with you and know you play, you try, you know, spin, I do a blaming game. We not work with that, you know, sir. We not work with that. We are only accountable, sir. Yeah, man. We are only accountable because you know easy none at all. So we are play that and here where I say yes, sir. Because let me tell you this. When you are in a position, you know, you run out a lot, you know. Any little thing you run out and yes, you want bad. Right? Yes. No, what you do, you spin as a minister, you spin. You want to push it on there so you want to explain to it, but we not listen. Because we not have no hospital, I mean, I tell you this. If we have hospital and the hospital, we're not talking about no rare type of blood. Because we don't know about AB, we don't know about the B blood, the B plus or the B minus, and we don't know about them. I don't know where other people have it. Other people have it. So on that prepare, but you make the people have to go on strike. When you get 300%, and people have to go on strike, and enough things that chop up. See? Nearly 700 billion spend only use in the hospital, we don't know where the money gone. But we don't have the medication, we don't have nothing. Mother says she sign, and nothing do. But no, you run out. We're going to dissect you, right? So. And you will get the blame, yeah? Yeah, man, you will blame, man. You can't trick nobody, boy, yeah, man. And you, the buck stop with you. We notice that you're kind of stylist. You run out and you make a speech. Everybody should have turned. Even the media, some of the media house now work. Because them should have burn you out straight. Yeah. Them should have burn you out. But I know she alone, death or death. I know she alone dead. Right now, in the hospital, them right across Jamaica, every day, the amount of people are dead. You go there enough, I try to survive, you know, but you not get the attention because not dead. It's like a big dirty thinking building. Unless you go the private one, then we don't have the money to pay. So that's a death sentence. A long time I talk for the people in Jamaica, you know. And you have some look 1 and 2 look people, you know, when you love politics, you just sit down there for a burn him and tell him, say, yo, you have to fix the place because our life at risk. We don't have the money. We don't grin on the teeth and make them go on 5 grand and go on a plate of food. I earth to yourself. Wake up. Time for the wake up, man. Wake up and smell the coffee, man. Get real. Let me start the program.
We in lump sum, we a beat it till the hammer burn. We now make them get in and them and again. None of them boy, we none of them. We in lump sum, we a beat it till the hammer burn. We now make them get in and them and again. None of them boy, we none of them. We alone some rise up the bomber day.
I'm not a Judas, them a backstabber. I'm gonna my wife, and she straight beauty and glamour. No guy can walk to near me with no dagger. Maybe the heart of Mandela, but the mind of a Zama in the mold. Like a bullman, we send us the jammer. Lyrically inclined, be a metaphor, so no listen to lyrics line to line. Become a lyrical fighter. Put up in the rhythm, they want some more hole in a hater. Lyrically inclined.
Yeah, man. So we are go straight tonight, you know, people. We are go straight tonight. Because you were tough time, I say yes, sir. I'm very unfortunate that them did this. I'm going to check the mother. Me like the mother moon no one see because let me tell you something. You can't if I me like the daddy, yeah, and the family there, you don't want to see tough time. You can't bring her back. Just make the thing them right in the place. Because if real blood shot at health ministry instead of say market me 85 million. Let me just tell you this. If I shot of real blood, people have the blood type in Jamaica. And if they are the blood bank, I have to give blood, you have to ask sweet in advance because she have to come a clinic or come a where you say pre-clinic, right? And then you need to ask the blood long time and tell them what is what. See? Yeah, but tell me what the people them they have no money at work when they go and they sell the bag of money. And he pack now, well led by Keith Duncan, him run out and I chat one bag of bullshit. And I talk about public sector thing it for freeze because they move it in the last year. And when they move it last year, for pay some people, but we will not pay with it at the 300% when they get the Prime Minister and them friend them, him colleagues, for them pay alone and the big police them and the judge them and all kind of things. We never pay up the people them nothing. And then they run out to chat one bag of foolishness because it to do this and it to do that. We're not full of shit. We're not full of so much shit. It's unbelievable. But go play this and see where I go. But go play this.
Health Dr. Christopher Tufton says he has received the preliminary investigation into the death of a 14-year-old girl at the Spanish Town Hospital on Tuesday. He was unable to say much, only that her death was very unfortunate. Jamila made.
You hear that, people? That alone for condemning, very unfortunate. Enough more people are dead in the hospital. I am at the cause of him, Yeah. You can spend like nearly 695, going to top of 700 billion. And you still in the hospital and have nothing. Nothing whatsoever. This bad. This bad, man. Yes, because you hear what I say, also.
Land has more in this primetime news follow-up.
Health Minister Dr. Christopher Tufton says he's visited the family of 14-year-old Anashe Campbell, who died at the Spanish Town Hospital in St. Catherine.
I'm very distraught about the situation. I fully appreciate and understand the sadness on the part of the family. And as I said, I visited the mom at her home, and we're tracking the situation to try and...
People, Tufton, what kind of foolishness you talk to the people? You don't know. He might talk to Emily. And I say him tracking situation. Him think he's a star, come. You think he can bring back our life? If you put the right things them in place. I'm gonna say if you do the surgery, them don't do it. But him talk like the surgery did up. Them not do it. Yeah, I'm gonna where she said all kind of things. And them that seek the blood and do the right thing. You understand? But most of them go on strike because them not have nothing to even eat. None of them can't even hardly move. You understand? You can't put nurse and doctor under stress because people are dead even more. When them can't feed themselves and feed them family under stress, you can pay for them bill. No, we have that put everybody's life in a danger who go to the hospital. How them going to operate right? A life and that, tough time. When you can't take up and talk about you have a pay a building and they treat at 20 billion, I know that building can't done for the sake of done. And them not move him, and you not move him. From 2017, the building I do. These things can't happen, and that's why you know PSOJ are part of the bullshit. Because if that was a PMP government and you sit on the 2 year past, 3 year, 2 term, the building I live out the whole 2 term. Can next year, I'm at a couple months for election. The building start repair from 2017. And now 2024 done. 2025 are coming in now. Same 2 term, it run out the whole thing, just repair. And you have him still as a security minister, as a health minister. This bad. This more than bad. Yeah, this more than bad. This dangerous. So people are left, right, and center and can't come out to him doing them the PR again. And you have some guy around them a PR them doing Tell like come up on the PR. Eh? Yeah, very unfortunate. And him a track it. Yeah. This acting up. Because you can't bring back her life. Them force her, they such have the baby instead of them do the operation. Remember, you know, them have no doctor work. Kind of make sense to work under stress. You understand? Can you imagine people are cut are going and you're not work under stress and don't know what they do? You're end up dead on the table anyway. Them can't pay them bill, them out to get evicted and all kind of things. Them can't even feed themselves. Poor doctor and nurses. Yeah. Yeah, man. Control big up yourself. See? Poor doctor and nurses. Can't of them not get no blame on from me, you know. Them are human being. Poor them. See? Them have just source and for work with. Eh? Him will spend the loot. The loot disappear. Eh? Them for hold him accountable. And then we have other people that talk to him and them thing there. You know, them not say about you as the minister and you were only accountable because you supposed to have the one of this in place. The buck stop at your feet. No two way about it. We have blood bank and blood bank. All right, so even the blood bank and them thing, that me tell you, the people them not go to do it. But him have to look about it. First, make the people them get them get the right salary. Make them comfortable that them can work comfortably in what they do best. Yeah? You see me I say? Them know this. Them should have a high-risk team and monitor. It couldn't be, all right, Colleen, see, you said something was very important. So, she have to go to the clinic, natal clinic, or go to the hospital, you know, go do her thing. And them a monitor her, right? Them, a source and them have a monitor, you know. So, even although you said that and that, you know, most of them are stressed because of Tufton them, you know. Just to find the thing at 695 billion, them can't tell you how the money spent. But it's spent. Tufton go on the pulpit last month and say, we spend, you know, when we come in, we spend the most money. And the most money equal this. Can you imagine Portia spend less, but you never see these things. You never see it. Let me tell you something, when I do them and do them PR, you just wait up and say, but hold on. Oh, them people that spend less on crime, but this is the result. Then spend less on this is the result. You know, we could have bread cheaper, food cheaper, rent cheaper, everything. This is the result and then spend less. We not spend more. But we don't know the money spent. And the people them not getting paid, so what to do with the money? Let me ask, where the money gone? Far, far away? Where the money gone? Where the money gone? Where the money there? Where the money there? Far, far away? This bad man. See? Continue.
Fully appreciate and understand the sadness on the part of the family. And as I said, I visited the mom at her home, and we're tracking the situation to try and bring some comfort to them as best as we can. While
so after Uno said your office set up the situation. Now you have been comfort to them. Who could have comfort you as a mom when you use a little data? And in the circumstances with the doctor and nurses under pressure. Because what am I trying to do, you know, is pull out himself and then blame the doctor and nurse. We can't blame them. You understand? But the mother such a sign, man, I make you hear the mother. The doctor and nurses, them get them under pressure too. Eh? If you can imagine you have hospital workers so comfortably, you know. Because it's tough than them, man. Eh? What them do show you a building and paint them cut ribbon. Me say I'll only start up on a cricket pitch, them a play cricket. I want to treat the people them out again walking and be, hey, only for run with only and stop make him trick on you know. When I play on a little ball, the other day him not, he must say, Radam to the same because you them. Radam 15 years. The man evil to Jamaica, look how him line up himself. Same sister there. The company leave her off because she get money for pay fee, but she never have the money. And you still have big company in Jamaica with them say she won. Won is not see what I want. Eh? Continue. When they say one like him a working brain for everybody, you know. Him and them, you know. Continue.
trying to determine exactly what transpired.
Dr. Tufton, who was speaking on the
Try to determine what transpired. Everybody see what transpired. Determine what transpired. Me no want to know what the mother may I listen to, you know. She go and she sign the thing. The doctor them go up on strike and the nurse them. The staff are skeleton staff and for them might do if they understand you try to do something and what happen. Them themselves are starved because of Tufton and the administration. Me not blame no doctor no nurse, you know. Not doing it. See? Because you can imagine you have your bill and your light and cut off and water and no food in your house and you're a junior doctor. Junior, not a senior and a junior. Yes, and nurses and them don't know if you go, you know, when stress kick in, you know, and wickedest thing upon them, you know, pour them. Pour them. Meanwhile, them watch them people get 300%. And them watch money fly all over the place. You might try to understand to get comfort after you're dead. All him need to do come in, instead of use the money for market me, and I use the money all over the place. All him need to come in and make sure the thing run good. Nothing no run good. The man have one place and all know it can't done. One. And then I want to tell about building every minute. We have built brand new hospital. Nobody build hospital and no hospital no build and open now. Nobody build like this administration. Let me tell you how owners are working. Only to come now and promise the road, and then tomorrow I go up on a pulpit and I look out the most road, and nothing starting now. In the PR. And we have to pressure him to look out the road because nothing will come, nothing at all, not come to where him talk, nothing. PR. And if you don't want things to do, if you're serious and run them way, it's a PR. You understand? They say I have to use the hospital and it's on the God. Will be my guide and God. Help Jamaica, Jamaicans, dear Lord. Help, help, help. Yes, Powell. Yeah, man. I hope the mother doesn't take anybody out. Mom, don't take nobody out enough from Tufton. And think about other patients that may have similar experiences. Why wasn't this young girl cared for at Jubilee? Good. As I said before, them have a strike and all kind of thing. Tufton, if film thing around, in that year, everything will go on when she come, then all kind of things. Them not working. Film team, them will go pressure doctor and nurse. And then when film style, I forgot blame doctor and nurse. Film style. But I him at the cause of this. 85 million for market me and all now. Uno don't get one. Uno don't even see where market me though. And everybody just silent so. Yeah? Everybody silent and you know says, I know, man can't take no money and go pass down to the woman. But you know see where it do and the money just gone. This is how Andrew want this around the thing in your face. This is what them do to your face. And then them have a funeral home named Archer. Archer when I'm counselor. When the body pile up, them do Archer and you know Archer they make money out of the system. Everything. Archer, them thing are nepotism and cronyism still, you know. Yeah? It can't finish. Them run the country to control it PR. And then all this still go up and field and play football and think people for run him where. Them for run him where. Continue.
The hotline with Emily Shields on Friday wasn't able to give much details, only that there were complications.
Complications around pregnancy and issues around, you know, a rare blood type of the mother. There was a surgical procedure that was advanced, and unfortunately, that did not go well, as we know.
No surgical procedure never performed upon the child. Remember me talk to the child, me call the grandaunt. Remember me do the thing before them put it out. When the mother come out, me call the grandaunt. See? When him talk this thing, this is how I'm wicked, you know. You understand? This is how I'm wicked. Well on there. That's why me like do this, you know. Me like do this. Me like talk straight to the yes. Me not follow them. Me not follow what you say. Eh? You ever go prenatal clinic, right? Yes. Whether the hospital, same hospital or something, and them that dock it and them that know. A matter of fact, them that tell them the risk. Them that examine and tell her the risk and them that prepare and everything. But the people them up and down, them you go there say 6 days and go there say 6 days. You're not more like you're not gonna see who you go there to. And then you dock it, people more confused more than anything else. Yeah? They might deal with survival. They saw the place upon a destruction part. Well, them destroy it. Them a ravage it. Me not hear the granite, she will call my back. But the whole of it a garbage. He blame everything, not himself. And him say it. Him say it. Yeah. Him talk everything where him want to talk, you know. You know it's a tough than that, you know. Remember it's a spin doctor this, you know. Yeah? It's a spin doctor and people never get it. I run down that something and show you the hospital. Remember the first people that in the hospital, you know. Remember, you know. I just show you that we are in the hospital and this are the minister. So you can't remember your life. Let me tell you this. You might have said something not sick, so I ignore it. And you're driving a car and you're in an accident. If it's bad and you bleed out, more likely you're dead. Something happen to you bad way, nothing there. Especially in the country. Nothing there public. And Jubilee. We're there in the country hospital. We're in it. And what thing the nurse them can do is just go work IMTR. The doctor them do just put on them because white thing and you feel good. By seeing them have the white thing and you see them with a needle. No, nothing. They not nothing, you know. You can't blame them. They not have nothing to work with. See? They not nothing. Yeah. 30%, man. 30, you know. Lawrence, at 30% him get. Look here.
No.
News of the teen's death has been crippling, especially for her mother, Christine Campbell.
She is selfish person, she don't know what's that happened to her right now.
She acknowledged that her daughter's pregnancy was high risk. It's why she says she signed the paperwork for the hospital to perform a C-section.
They explain it to me, say, mother, she may lose the uterus, or rather lose her uterus than lose her life. So I sign.
Maternal death remains a major concern in Jamaica. During an emergency press conference in June, Chief Medical Officer Dr. Jacqueline Bisesa McKenzie said the rate, now at 130 per 100,000 live births, is too high. This is
130, mother. 130 live birth. 100, whatever 100,000 live birth. She said 100,000, she's saying, I'm a year. That's 100 live birth. You can't have 130. 100,000.
McKenzie said the rate, now at 130 per 100,000 live births, is too high.
This is not something that is good, and I mean, it's something we have a discussion about almost every day, you know, in saying how do we bring down these numbers.
Come 2030.
Saying how do you bring down the numbers? How do you bring down the numbers? You spend the money for going to healthcare. Can't bring down. Because a C-section, you know, try make them have birth and thing, but them not have the money. All them are cut with them finger. Who didn't know do them kind of operation? And every doctor do the surgery, you know. So you see, the other day, only he might talk about him and look 700 on a doctor. Most of the doctor them gone. Only not pay them. Yes? Tufton them not pay them. No. Most of them gone. Enough nurse gone too. Them that carry a nurse from Africa and Philippines. Some are outside them go for nurses in Asia and them places and Africa. This is how them are treat with people. You understand? Africa, you know, so they might get a bamboo and them for going, man. And then you have to spend more money because you have to put them up for them come and what have you carry them and them family and everything. And they need for to pay the people them right. Yeah, a penny wise and pound foolish, you know. Then, you know, pay the people them right. People them living in them own house, you don't have to do certain things, just pay them right. Not even that. The blood bank we should have more than one of that. And the money we do market me should have run blood drive. This is Sam's house. The buck stop with Christopher Tufton and overall with Andrew Onis administration. No two way about it. You remember when Tufton, what his name, Dr. Fenton Ferguson, I run out upon him? Remember? You can't have it two way. You cannot have it two way. Yeah? Market me. You might teach about healthy eating. I know nobody not seen up with the healthy eating enough. $85 million go to woman for sashi. Yes. Yeah, man. 85 million for meat. Rent meat. Yes. Saying money just comes to taxpayers' money. Taxpayers' money. This bad. It's bad. Yeah. Saying he's passed away in Spanish Town Hospital recently, buried 2 months ago. I've heard 3 children in Spanish Town. Yeah, hospital. Yeah. When I file and the hospital no good. We know about the hospital. But hear this. All right, let me tell you something. Yes, the real truth. All right. So we know about the hospital. We know about it. When we know the hospital not good. The equipment, them over there. They work not up to standard. Remember, you know, if somebody work with you, you know, you want them to pay, but you have to have everything there. You can't just up in a gown and come and then me look. I'll show you a Spanish Town Hospital right now. Me see. Me have it. See? Them want to just come and bond the doctor, them and all kind of things. It don't make no sense. You understand? Yeah, no man, anybody could have run a alright. So I'm the best one for it. You know, say we always say Lawrence would say, you know, doctor of marketing. If you're a doctor of marketing, you're supposed to know, say, well, you know, say, see me have the marketing, you know, say, I try to get up the things them for in the hospital. Because, you know, marketing can do, of course. But, you know, say, I get in the medication and get the thing. All they need for do, you know. You just sign off on some things and you make sure the people them do them work. I'm a fucking novice. Let me tell you this. Anybody with good intention can run the hospital and be the minister. Anybody with good intention. You just need good intention. Because when you really look over the world, it don't mean say you have to be a doctor for run the hospital as a doctor. You just have to have good intention and some morals and think about people. Yeah? Yes. Take it from me. See? You need people with good intention towards people. Not PR. And count them like you just count them as a number, like a 1 and a 2 and a 3. You understand? You see me I say? See, yeah, him see Mark play cricket long time. Yeah. You understand? Him play cricket long time. And you can't send me back. So, he might do all these things, but people must say, follow him. Make him come and know you. You just need good. Let me tell you something. Only thing you need in an administration for run it are people with good intention and morals. Morals. You understand? Yes. Yeah, man. No, but I really think I talk. So if all right, look what me I said to you now. Look what me I said to you. If me in charge of this, me now, me I take 85 million and get a woman because me will rank. Yes. Why? Taxpayers' money. You can't do that. You don't know, say no, but this is not good. This could have buy X amount of bed and medication and everything. You understand? And then trick the people, say it's a market. Oh, it's if you tell if you eat, or if you eat healthy when you don't have no food to eat. So right away, you don't know, say, but them don't even have food at them house. You know, I do as a minister, I do like what man didn't do. I nutrition for mother. With the money. You understand when I say good intention? Nutrition with the money. And then build back something for them mother there. You go prenatal clinic. You know, them need nourishment in them body and everything. And we'll give them some package when them come and we'll reach out to them, make them come to hospital. So when them come each time, them have package to go home, with them eat. If them forget vitamin and iron, with them forget. Because when you test them, you know, them lack of some things. Because them pregnant. So we'll make sure we have these for them. No, so it forgot. You make sure them examine proper, because see him talk about people forget pregnant and have more babies because the thing the population get old, and so we are losers, all right? Doing good. You know, come in with something where, you know, seem like you have family values. They promote. Them not have good intention. Andrew not have no good intention. Andrew have bad intention. Andrew lying himself and give you a peer. The whole of them do the same thing. Nobody with good intention when they look upon you for give you $5,000. And look upon you and tell us, yes, you are labor right. And you know busy about the rest of Jamaica because them are paying peace. So we not give them nothing. You don't really do government work that it spread that everybody okay. You know, one handout. Like a man, they say no handout. See? So all they need, for run something you don't need nobody if you have no doctorate and nothing. Good intention and morals. Because at the end of the day, no, you're not a doctor. So the doctor, them are going to do them work. See? The nurse, them are going to do them work. But them have to have everything for work. With. You have good intention, you know, say, okay, police is supposed to live for people. Buy them and I fling them in a jeep back with them walk with them shoes. Contamination, germs and everything, you are dead. Hurt your spine, do all kind of things. If them have good intention and know, say, hey, you know, say this wrong, we cannot treat your people like animal, them kind of way, yeah. Then, you might buy ambulances. Real, I mean, I talk, the little E20, and push a little gurney in it, the little piece of shit, and carry around in it. That is shit. Enough people travel and them know what's the hospital and one white, you know, curtails and one white female, entails. One white entails and one white female. See? So you just try to do the right thing and stop the foolishness. See? Them not have no good intention. Them not have no morals. And that's straight. Them not have none. So we are blame Tufton. Tufton and you can't get from this. See me I say? Yeah, man. So I feel like they don't pay the price for this now. Oh. Yeah, man. See? This bad. It's bad. So, see there? So, yeah, man. No, but I know those large family, them say they think, you know, we think a water out, so them need more kids. I mean, I say then we could try to stop kill off the youth, them. I'm trying to make them stop kill off themselves and do something else. Because them they already. But then I try to grow them from down here, son, then I be a thing. They rather spend more money on this. Instead of prevent crime, go and fight it. Fight it when it happen already, you know. You don't want to stop it. You don't want to stop it. That don't make no sense. Tufton this bad. Make me hear what I say so. Yeah.
The global maternal death rate should be reduced to 70 per 100,000 live births. For smaller nations, 100 per 100,000 live births. To achieve that, it means countries like Jamaica must take steps to improve the care of expectant mothers up to the time they give birth and beyond. But with less than 6 years to go until 2030, is it too ambitious? Can Jamaica achieve this very important sustainable development target? Anna's mom weighed in.
Money can't buy back Anna's life, no? But me just want them to learn that if another thing like that for happen to another mother, at least them can try to do better.
Anna would have celebrated her 15th birthday on January 5, 2025. Jamila Maitland.
Oh, she's 15 January 5. Yeah. You understand? I know. So she's smart. Yeah. See? So Tufton, you know, you want do your thing and spin. But let me show you the hospital. Let me show you what I talk about Tufton. I know just that alone. Health. Let me just show the health and just remind you how the hospital stay health. Yeah. We get reality check, you know. Remember, I know, the one alone dead in there, you know. You understand? Tufton respond to travel advisory. Hear the travel advisory where you tell your people,
Health Minister Dr. Christopher Tufton about the U.S. advisory warning travelers about the poor state of the country's public health care system.
This is embarrassing. Look how long me there want him and it coming like me just a beat pan them. But let me tell you something with me, you know. You know, say them thing I'm gonna show you say what me do run them in the tabloid. When you have the US first in history put out a health warning on a place. I remember now on a war one then on a war one place. And it have to come with a health advisory 2 times. And put travel advisory, you know. It stop them people and tell them to be careful. The hospital not good. Not my saying. Remember me I show them these things long time. But some people that sit down now, that's what I say, you see, uno people will not vote. You know, just watch my style. But the things that just help uno still, you know. And open your eye. Because I'm in the tabloid. Saying, when the US have to come and do 2 times and show help advisory. We never happen them all the travel advisory on crime. Yeah? National security issue. First time in the world, they say them at show. Remember, it's not a pandemic or nothing. Show health advisory and say, no, be careful. Not my word. Listen when US have to tell them. Remember me, I showed them this long time. That for sure said the girl is imminent. Anything you happen, see there. See there? Hospital not good. US have to come out, come show this. And then when them go show it, twist it at Tufton and try to spin it again at our board to collect money. That ain't the problem. Because them people don't come to Jamaica for go see this. And then the other day when they go up on them pulpit, them attack Andrew them come back and attack about Andrew Honest. But the health system and people that get old in America and in Canada, and, you know, the health system, so we can do a one-stop health system for them. That's stinky. Eh? Look at, hear this. Destroy the state of the public sector, the health sector. This.
As you'll hear in this report, the minister is renewing his call for the implementation of tax, which he believes can help to fix the problem.
Tax! Fix the problem. The man have 695 billion, but we don't know the money spent. And they must say the tax. For tax white people. Or tax the tourists them. Fix the problem. You say you spend the most money. You just come on the pulpit because of this. But the other day you said this are the tax. You believe it can fix the problem. That make any sense to you? Eh? Him do too much spinning, brother and sisters. Yeah.
The healthcare ministry says the recent U.S. travel advisory has created a negative impact on the country's health system.
So them create a negative impact on the country. No! Christopher Tufton and the government mash up the health system. Tell me something now, when they say 18 and a half years, you never see them travel advisory, you come up. When the people are this, let me tell you now for weird things. Let me teach you now no weird things. You see when them come and say 18 and a half years and join up and down, you take them things and you wait and say, but me never see in a Porsche time or Patterson or Mandate time. Me never see them health advisory. Never. Never, not even one time. Never. Yes, of course. I'm not on my live, man. Soon call me. You call when you miss me on the live, you know. I'm soon call you. Yeah, man, I'm soon call you back here. You good though.
The international scene. The advisory issued on Tuesday urged U.S. citizens to reconsider travel to Jamaica due to crime and medical services. Americans were told that emergency services and hospital care vary throughout Jamaica, and response times and quality of care may vary from U.S. standards. The U.S. government says public hospitals in Jamaica are under-resourced and cannot always provide high-level or specialized care. Health Minister Dr. Christopher Tufton says the issues in the health sector cannot be looked at in a silo.
The issue is a lot more complex than it appears in a release or an advisory. The solution can't be that we must do more
Yeah, mix up. Look how him flap himself. The solution can't be, we must do more. Them not do nothing. Man, I show them the hospital, them not doing nothing. Them not have no ambulances. Just look for your own self. Look how people want to puff and nebulize and drop and dead in a hospital. And him say the solution can be able to do more. You understand? See? No, on a contract. Them have them on a contract, them man, you know. I don't think it's a contract, no. It's like how you have term limit. That's why the politician them have term limit too. Yes. You understand? Remember them swearing, you know, it's not a contract as a contract like that. You swear in and then you do. If you do 6 years or something like that, you know, 2006, 7 years, and then, you know, yes. See? Same like how the DPP for leave from 2020. She for leave from 2020. And them go and change up the thing. That's why they move around things. Same thing. You understand? Yes. DPP for leave from 2020 and them push the DPP over. You understand? Everybody them have something with them for leave and see? Alright. So you hear what I say, so this is bullshit.
The solution has to recognize why there is an inadequacy to the extent that there is, and how collaboration between public, private, and indeed between jurisdictions.
That is bullshit. This is PR. So you can't talk about this. You think about collaborate. You don't collaborate no public with no private. Private are private. You have the money, so you spend the most money. But the results don't make no sense. So this is why I'm doing spin. That's spin doctor. This don't make no sense. This is bullshit. This is straight spinning. And it costs life in Jamaica. Lives. But them count it as numbers. So it hurt people more and more. This is sin. This is goddamn evil. This is a goddamn disgrace. So when them come and them spin thing like this, where you do listen to him, spinning thing but like your health. Remember you have gratitude, you know. The for una losing no granny no matter and una self. When them come and say them spend the most money, but we don't have no ambulances up and down. You know, if any little accident, we have highway from highway 2000 and thing. Any accident, dog nam no suffer. This bad. Bless.
Can address that inadequacy. And it holds true for Jamaica as it does for many other small island states within the region, and indeed even some of the larger countries.
And again, an appeal for a health insurance tax for all visitors to the island.
It is not unusual. It occurs in other jurisdictions like in Europe, where that tax is required. And if that were in place, maybe we could have a more efficient response, because maybe that tax could be used to train more people and perhaps provide more facilities.
Opposition spokesman on health, Dr. Alfred Dawes, says the advisory is a wake-up call for all Jamaicans about the state of the country's healthcare system.
You hear that? That's it. It's a wake-up call for the state, like what I say. But this man, when him go around and him do PR, all this, because when him just talk, I want back a bullshit. Let me show you something. I wonder if I can get that. I wonder what that's up. Let me see if I can get that, you know, Dr. Daz. See if I can get Dr. Daz, Dr. Daz, where they know, Dr. Daz. Well, let me see if I can get him from the phone here. The man do too much PR, man. Man do too much PR. I said we can get Dr. Daz or so. See? Man do too much PR. See? Let me just go in at the same time. So them do a travel advisory. And the man come out and do bullshit. Don't look on this. Look on this. Same time. Look on this.
A sobering video of Gifford Henry drawing his last few breaths on this earth last Thursday. It still haunts.
This is the other day, people. I want to look on this and tell me if Christopher Tufton and Andrew Wallace mean people not good. If him a work or a PR, him a do. This is a Lionel Town Hospital. I will talk to them and remember me I show them what I think them from when, Till US have warn them people because US watch everything and them a test them and got them check them. Eh? This is not a, this is, hey. And then Andrew come tell about him at the best. The one of them come and tell us them at the best. A man like this, the man, me the human rights activist work. The man, him do it, him bad for the people then. And can you imagine you want a nebulizer for Christ's sake. And the hospital where you are bad for you go down there. And you gasp for breath. And drop on the ground and dead. And you're nothing else. Them are dead, they draw a card. The nurse, them have nothing, them have hand. Where you do suck the nurse finger for open your earway. It can't work. The nurse can't push her finger in your mouth and say book back. Them see now nothing. Short a doctor, short staff too. And no medication, nothing. All them do is PR and tell people like, but people are dead. And we have the proofs in front of we are. Just to remember different hospital may have shown now. So the young girl have to succumb to this. Prenatal clinic there. And you go there, you prepare and think about what them have. Nothing. The more can just talk to you and just hope you come through. Yeah? The money I spent, but you don't know where the money gone. It's bad. Succumb to, okay. Anybody who say only side, you're right, Omaris. You're right. See, people them are dead front of me and you listen to these people. Only them shouldn't even walk and chat to nobody. Because this happen to anyone I know. When they just stand the plate of food and a pies now, and they come and have the cow and go to the hospital and drop down and dead. Because nothing do they for save. Not even little busy. Backs out the little pies. This bad. Look on this. This touching, this touching bad. Look on this. Just look on this. And who really caring have a heart to tell me say that listen to Tufton and all this them? What most of them spend the most money? Look on this.
A sobering video of Gifford Henry drawing his last few breaths on this earth last Thursday. It still haunts his family and friends.
Stressed, tired, disappointed, frustrated. Just a few of the adjectives used to describe the way I'm feeling presently. This and the disturbing news to learn the distress that my father went through at the Lionel Town Hospital. He just went there just to get assistance. I mean, that facility is there to assist you when you need help. You're sick, you go to the hospital for treatment, right? You go to the hospital, you're expected to come out back better than the way you went there.
The dead man's loved ones said the brutal irony is that Mr. Henry, as an active member of the Community Citizens Association, lobbied political representatives to supply nebulizers to public health facilities in Clarendon. But on the night in question, he himself could not get one of those very machines as his asthma condition worsened.
Him and the man who come here and beg a council, say me that like for get even two for the Lionel Town Hospital. And when me hear say it him go figure use and it's like some negligent and him not get through and him die, him not really get the assistance when forget, me feel cut up about you.
He was a champion for the community.
So people, let me just stop this. Yes, sir. I'm going to drive him up back. You're a champion of community. You're lobbying for these things. And you have an asthma problem. And not even a pump. Can you imagine little baby go there are more people, them that have asthma attack, and more people they have asthma. How much of them that dead? The nurse now have nothing. Can't give him nothing. I'm going to think the nurse could have done maybe push a finger in her mouth. Yes. Because what shall I do? We're so campan. This is a dead man, We bury, We had a place him that safe. Him sit down, can you imagine your lungs, you can't catch air. And them can't do nothing to you. Yeah. I'm the nebs him. And then only them I come tell you them spend the most money in the hospital. Our people them are dead, And it dead in a way that's dead on camera. And you can't come show it now. And you know what? You're nothing at all with them I say because them are take a video. You understand? Look on this. The man that dead. The man that under the ground right now. He's not alive. He's dead. Them now have nothing for give him. And there's a hospital him go. And I saw owners of the thing them around them. Yeah. And I'm like him, I say, I could pay down the austerity. I could pay down the debt. Bring down the debt. And I watch much of them dead. Them now have not noticed. Because I remember they're hungry, you know. Let me take the box food. You don't take this amount debt. Is a bad government. Is a nasty government. Yeah? Look at the man, him not exist no more, you know. Him a rotten dog. Him in a box under the ground. Eh? And look on him. Eh? Look how him stay with the thing around him neck and take him last breath. Can't breathe. All him himself go there, him no know what's dead, him a go there. Can't breathe. You tell me if this is not bad. Eh? Eh? Him drop off of the chair. Yeah. See? I'm telling you need caring government. And people with heart and stop the PR. Just hear how I'm dead. Hear this.
A sobering video of Gifford Henry drawing his last few breaths on this earth last Thursday. It still haunts his family and friends.
Stressed, tired, disappointed, frustrated. Just a few of the adjectives used to describe the way I'm feeling presently. This and the disturbing news to learn the distress that my father went through at the Lionel Town Hospital. He just went there just to get assistance. I mean, that facility is there to assist you when you need help. You're sick, you go to the hospital for treatment, right? You go to the hospital, you're expected to come out back better than the way you went there.
The dead man's loved ones said the brutal irony is that Mr. Henry, as an active member of the Community's Citizens Association, lobbied political representatives to supply nebulizers to public health facilities in
Him lobby for supply nebulizers to public health facilities. But when him want, see me?
A sobering video of Gifford Henry drawing his last few breaths on this earth last Thursday. It still haunts his family and friends.
Stress.
And I am alone, you know. Look here. Tufton, may I tell you, I know him alone. Look on this, Tufton. Look here. When the people them come out, what you think? Look on this.
Andrew Oles. When I do about my situation? When I do about the doctors?
People, when I play it, I tell you what I like with them video, you know. When I play it, and I like when Andrew get kicked out, him can come play them. You call him name Andrew Ones. You can't edit that. Christopher Tufton. You know what for them time. And we play it because if them feel so when they get kicked out, them can complete. No one complete back and say, yes, how RPG say Andrew Ones. And them there already. So and like them can come rinse them in a next man time and say, yes, I do this now. It's Andrew time. Say me?
Them a KPH. When I got the boy help. When I do boy help. When I do. When I do.
A gunshot him get a female, you know. And then the 18 hours and I get look out because the doctor them now have none. Hear this.
When I do. When I got the boy help. When I do boy well-being. When I do boy welfare.
I remember, you know, if you see Tufton sick, Andrew them, you will never see them and them family pan a ward there. Say if them now go pan it, go get admitted same like anybody else. This no good for nobody. And so me see it. No good for nobody go pan it. See it there, 18 hours. See that?
When I do. When I do. When I do. When I do. Jamaica. My Facebook friends, I'm wanting to post this wide. Post this wide. See there? About at 10 me get shot last night. Then bring me come from ICU you in a no time. Put me on ward. See, I'm up on ward and a head shot me get. Me get grind shot. See there? None of them don't know what to do. Me a bleed. Me a bleed out from the whole of last night. And I'm here, me go get surgery. I know that's I can't hear. I can't get no water. The sailor now I get done. They will keep me quicker than now for them. My system empty.
Saline, important him thing say him have just get the little saline, you know, and that's it. The little glucose water, you know. Yes. They don't have nothing. And then you couple it up with the people them not get paid. The rape victim, him not got the mother. Him not got them talk about it. Him talk about it. Look here. We just have run through something with Andrew Woness, you know. It's that same Carnal Regional Hospital. Look on this. Look on that. Look on that. Now, just look on the chair them. Look on the bed where the people must sleep on. And you feel good about them things. Eh? And you both so you spend the most money. And we show them things here. Remember, you know, US have it, US travel advisory. Then them talk about bullshit. But him are the best. Him are the best minister, eh?
Okay.
There. Look at people. Look at people. All right. Look at them people now. Can you imagine you sit up asleep? You sit up asleep. You know, get blood clot, man. Some people, maybe them have diabetes and all kind of things. Them go to forget doctor. Look about them, them sit down in a chair and have a hope. And when them dead, them just move them. Some of them jump off a chair and dead. And this is about people, and this is about caring government. I don't know, come tell me about this about the thing, criminal government. Nobody come tell me nothing. A long time I talk about this till America for come and give them travel advisory. Me that tell lie, no. Me just you know, expose them because dirty corruption deed and the money we are chop. And them are killer for people there. Né? That's what I mean I will this, you know. Come all out. I remember, you know, it's international country. It go around the world. Then they come out and say, you know, you can't think of no asylum, maybe if you collect from this. This is bullshit. And you're not supposed to walk, not going to play no cricket and you chat to him. We're not dead in our jobs. This is bullshit. You understand? Look on this. How about people them this? Look here. Look how him name. You know things saying at the zombie, one of the zombie show. Look at them. Just look at the bedroom and go. Look at him asleep and him like him. Just look here. Look here. Look there. Look at them. Look there. It's like a zombie. Look at the woman there. Look at the man there. Look there.
Who that?
$500 for cardboard.
If I have power down there, go on and I like you want me to come out for gain it. I'm going down there, man. I'm down there.
Then when you don't know, Big Mama and the one of them I put up Christopher Tufton, them are the best performer. Now, if they put you up as the best performer, the way you think they can do, I dig down in the background, eagle have to fly. Because we are telling them say you're the worst. Yes, they have worse than you. Well, the one of them are sub-zero. Below zero, yeah. Not just zero, but below that. And them are colder than North and South Pole. Colder than Antarctica. Yes. Them terrible. So them the PR, I don't joke man because that's PR them I do. The whole place mash up, you know. If you want to mash up. See the foreign girl come and lose her baby and look at them, look here. And now nothing. Remember the nurse. And the nurse buy the thing like that.
Hold on. Where you want this to go?
I gotta use the bathroom.
Yeah, this is
I need something to wipe, but I have to use the bathroom right now.
Yeah, but you need to.
I've been asking for tissue since I've been here. I've been asking for tissue since I've been here.
Yeah, but this is not.
And there's still no tissue in any of the bathrooms. I've been asking for tissue since I've been here. I've been asking for tissue. No one's giving me any tissue. I also need another diaper. I need another diaper and I need some tissue. I've been asking for tissue since I've been here. Now she's mad because I'm using paper towels. What else am I supposed to do? Can I have a diaper, please? This shouldn't be like pulling teeth.
This is. We don't provide those personal things for patients.
All right. So the one chat the truth. You don't provide tissue and sanitary napkin. I know she lose her baby last time. And I'm foreigner, you know, it's American. Then they provide them things for patient. Yeah. Yeah, understand? Then Tufton run out. You know, we have a nice storeroom. We have 1,500 roll in a nice storeroom. Now you say, you know, there's somewhere else. But, you know, the truth is, when you put the toilet paper in there, people thief them, and these people. There is no, me not ask you Tufton. If people can find them money, number one, nobody no want to touch germs. And you can't put a toilet paper where you just put it down where everybody will touch it and roll it up. Me, if me the chicken and this, me not use the toilet paper. I'm not using it. The immune system already, you know, yeah, it breach. So you use something where everybody can touch. That not gonna work for me. See? Who gonna leave and go a toilet, go at them do dirty place. You never want to go into the bathroom, go use it. Somebody come look for you, carry food and carry things. They might spend their money and drive and come there and do something, take bus out of the world. Toilet paper where them can buy. They might thief for toilet paper. You get church too, you know. And you thief for toilet paper for carry money. Leave from so far, spend the money, I bet you know where to go. If you go thief for one roll of toilet paper. And then the roll now go just big, so you know. People can use it. Like can I touch it and you go there for thief for toilet paper. What is stop embarrassed? That for show you how them look down upon people, you know. Only screw. You look down upon people. Only say, I say, well, you must blame, yes, the box up with you too. Then you are the chief servant, man, with some guy where only have be a shit when you do the whole honor. Yes. See? This mad. You understand? Some can't come blame. Nobody has pinned the little girl dead now because we see it all over the place. Look how the hospital stay. You get travel advisory. See? This bad. Bad. We play this. I mean, I have enough more campaign on this. Look here. Look here.
Tufton, the hospitals in Jamaica short a bed. It's short a bed and people are dying. People are dying even when they can get help. And it is a very sad state for the country to be in. Any country that cannot provide good medical health is going nowhere. Is going nowhere. All right. Result come back by 10:30. We say we need to get her to move now. When I went back to hospital.
Control, we could have enough hospital in 20 hours. And we could have said we had to do something, but remember we can't leave it. We have to have people volunteer and set up this pan a little bit. You know, them go there and who are go there now, either meet them person and give them the package. Because you can't leave it to the hospital. Tough to have some people work, they might just move the people things, man. And them not get it, you know. Because sufferation all over the place. You know, yes. So you have to try, you know, I'm big volunteer, big thing this, but we should know when you put in government and them supposed to think of to do something like this on a scale, we shouldn't even have talk about this. We don't have no ambulances, none. Say none. We don't have none. The little one them a move around, that's a joke, you know, because them just a move around from a hospital to here, so them don't really have nothing. You know, so you get gunshot, a police a leave. That more hurt more than anything else. You know, accident them live by hand and foot, it more hurt you. It more the damage. Sometimes I move, they move you, they move it, kill you, you know. I will cripple you up. Yeah. So you swallow by your blood or something, your throat, you wait for clear them don't know, them just lift you and put it on your back. So this a drown you. Nobody clear your way, them don't know. No paramedics. Then just leave you and just try in our back or thing with them dirty shoes upon. Something happen at them and lift you up. And you could have be wherever you want to be, but you depend on the road and you crash. Even if they might carry you go the private one, they might lift you and take you out tight and do what they might do with you. And this was about, yeah. You understand? Them have tissue holder, all them need for do, Johnson put in tissue holder. But them not put in a tissue holder in Jamaica. They might say that are too much money. One they could not think in tissue holder, you can't put in a bathroom. We are said wrong. The woman and mother dead and she take a week. For them just write her off. Because them not have nothing, them never have nothing. She have to buy the medication. You still only come and tell you say them give the most medication how much enough. Tufton. Well, I want it to him because it matter about one is the best and them that put back one is. It matter about Tufton and the best and that put back Tufton. One is and Tufton, but are the same thing. One of the same. Yeah.
Farm better say, all right, how are we going to transport her? Can we get a JDF helicopter? Mister, what's the procedure? Ma'am, we are trying to work out her to move, but there is no ambulance again at Falmouth, so we're trying to get an ambulance from Montego Bay. Mister, can we pay for private? Dr. S. Dixon, go and tell me if you even pay.
I try to call back Dr. Alford, the Shadow Cabinet Minister, for help. We ask him something right as you know? Yes.
Pay for private, no nurse will want to go. It's about be serious. Before we reach here, sir. You know. Monday night, when we went to look for my mother, remember so she admitted.
Yes. Dr. Daz. Dr. Daz?
Yeah, man, how you doing?
Hey, I'm not there, man. How you doing? All right, now for call you because I have some people here, so I have to call you because the government really draw them foot and really angry people so bad. In the health sector. More you give me a quick run on that. And the little girl were dead. You know, her mother go through this and me understand with the doctor. And you know, Mr. Man, me stand up with the doctor them because none of them have problem too. Junior doctor they can strike the same time. No medication, no at the hospital. You can tell me if this government really do a good job or a bad job, sir.
Well, you know, let me just touch on the baby that died. It's the young girl that died. Tragic story.
Yes.
Condolences to the family. I see a lot of spin putting it on the doctors who strike. That's the strike ended at 6 o'clock, you know.
Yes.
At 6 o'clock they were back to work, so it's a couple of hours. And from what I'm hearing, she was there for a while. So I can't comment because I don't know the details of the situation.
Yes.
But certain senior decisions, certain things may have been picked up on. It seemed like there was some what you call postpartum hemorrhage or something like that, where there was a lot of bleeding afterwards. You know, it's one of the higher rates of maternal mortality in Jamaica. Overall, outside of this case, too many mothers are dying while delivering or after they deliver. And postpartum hemorrhage or bleeding after the deliver.
Yes.
Is a problem. For, you know, overall, especially in the southern region, where that has the highest rate of maternal deaths island-wide.
Oh.
So we need to fix this. This is just another symptom. So you know, when I thought that we're going to see more of these tragic stories manifested, it's not because I'm calling down things, and it's not because I'm being accused of being an alarmist or a mischief maker. It's because I know that there are systemic issues. So it's like you have a viral infection. One of the symptoms is a fever. One of the symptoms is a rash. If I see you with a rash, I'm going to tell you that you're going to have a fever. So I know that there are systemic issues with maternal care in Jamaica, and you're going to have more mothers dying from childbirth. So that is the situation that we're going to see, and in this case we see it pan out right now.
So tell me something, the hospital still understaffed, no ambulances, no medication, because I just play the lady where she have to buy medication for her mom still died. I play one now with the brethren from Lionel Town. Him sit down and him have no That thing the way you take for asthma.
Yeah.
Wait name?
The
Nebulizer. No nebulizer, I'm die. So how is it that, you know, and the meeting the other day, the JLP meeting, them said them spend the most money, but we see less result. Nothing in the hospital.
Spend the money on what though? Alright, so this is a policy issue. We have a lot of systemic challenges in the public health system, and the policy decision of the government is to spend money on buildings. You cannot refurbish buildings and think that things are going to get better when you don't have basic supplies, when you're understaffed, when machines breaking down because you're not maintaining them, and so that you've spent $140 billion or whatever it is. You cannot do that. You have to fix the boring things that don't involve ribbon cutting in the hospitals. You have to pay the suppliers so that they can provide the disposables, equipment, and so on. And that is another problem in a way that nobody talking about. Ministry of Health doesn't know how much money it owes suppliers are providing.
Wow.
The debt of the Ministry of Health. You see, they suspended the radiology program.
Yes, yes.
That is because the people weren't taking a lot of people were taking letters of commitment from the ministry, and the ministry cannot afford to pay out to cover these services because they have such a massive debt to clear. But if you ask the ministry now how much money do they owe suppliers, they cannot tell you. They have to scramble and try and find, just like when they started asking questions about ventilators. That is when they started to audit how many ventilators were working. But it's a massive problem that we don't know the extent of it because nobody has been keeping track of it.
So you're telling me that, all right, so we have a great problem because we are looking at $3 trillion problem, but we don't know the money spent. With the health ministry now, it is 695 billion we're looking at. But we don't see nothing for the money and nobody can't tell where the money is spent.
You see, the thing with health is that you can do emergency procurement and nobody going to question it because it's health. So you can have health tied up in procurement while people die and suffer. So because of that now, you use that emergency procurement to procure a whole heap of things. And you don't have proper oversight. We saw during COVID where they were using invoices to pay out massive amounts of money instead of having proper contracts in place and perform invoices. So it's a culture of spending without any proper oversight that has to be addressed immediately. And the truth is that, you know, if you increase the health budget and you don't manage how the money is being spent and where it's going, you're just wasting taxpayer dollars without having any beneficial outcome to the patients and the workers in the healthcare system. And that is exactly what's happening. So what people don't understand is that the health sector is on the brink of collapse. This is the worst many people have seen it in ages. And if you can look at it by the numbers that we're sending out to PAHO and WHO, we are worse now than 30 years ago in terms of our maternal death rates, or babies dying at a higher rate now. And on top of that, you have diabetes, hypertension, strokes, cancers, all increasing. Now the population is aging, but you're not screening for these diseases and you're not managing them before you end up in complications. And that is why we are seeing a higher, not just a higher cancer rate, but a higher death rates from cancers versus other countries where you have cancers going up because they're finding the early cancers and curing them. So the death rate goes down. So it is not a matter of a lack of understanding because you have enough technocrats in the Ministry of Health who know this. The problem is the policy direction. The policy direction is being on TV, cutting ribbons, and refurbishing places so you have pretty buildings to open.
To do PR. That's PR.
Putting lipstick on a pig.
I put lipstick on a pig. I can tell you, big up yourself. You put lipstick on a hog. Yes. But this now, we have to reach out to the masses of people because this is very serious. But at the first, a matter of fact, this is the first time in my lifetime never hear a country, not in a war, not a pandemic, not an epidemic, but get a travel 3, travel 4 advisory, health advisory. America give Jamaica travel advisory, you know, and wanted people. That not bad for the country, man.
That's another first for Jamaica. And we are seeing where visitor arrivals are down. No, the murder rate is down. So we can say that, all right, fine. Crime is not as bad this year as it was last year before the travel advisory. So you could petition the government at the US and the embassy to lift that travel advisory because we are supposedly better off this year than last year when it comes to crime. But you cannot do that because health is worse this year and it is getting worse and worse than last year. A tourist coming in will not have an emergency service because the ambulances are out of commission because they're not taking care of them, they're not servicing them. And we just don't have enough in the fleets. So, and then the hospitals don't have any equipment because they keep breaking down and they know you can't even outsource. So if you have a CT scan that is needed to diagnose a stroke, normally they would send out the ambulance to a private facility. Now, when you take that away, you just don't have any CT to get unless you can come up with the money yourself, which is $20,000. Average Jamaican can't afford that.
So when them outsource, all right, when them cancel that thing that with them people them are do them little ultrasound and them are do this, that people them depend them own same way now, nobody pay nothing for them.
They're on their own. They have to pay for everything. The MRIs, which are $48,000, they have to find the money to pay for them. If not, it just means that if somebody has some medical condition and needs surgery and you would need a diagnosis to see how you can better treat it or if you can do it non-operatively, that option is out of the window. And you now have to just carry everybody to theater.
Hey, maybe say something to you, right? When you go see the
you mash up our meeting on me, I know.
All right, no, you're going to run now, but me I say something to you. When you go see the murder rate down, I forgot to tell you, say, Peter Bunting just answer them because I may have some police brethren talk to me, them hide body here. So we know say it not done really, yes.
Well,
And then,
that's why I said supposedly.
oh, supposedly, all right, okay. Yeah. All right, going back to your meeting, and next thing, the people them say it gone, you know. Them not say it upon the bring, the people them say tell you it gone. But before you go away, when you going to do, because remember, you know, you want to audit, you know, you want a forensic audit, you know, when you know becomes the health minister, you have to do a forensic audit, right? You plan to do that, don't it?
We have to know where we started from. First of all, we have to find out how much money owed. You have to bring in auditors.
Okay.
Because we don't know how much money is owed. You're hearing single providers, contractors owed hundreds of millions of dollars, and you have several of them right across Jamaica. So we need to have a starting point. If things are so good, you know, we need to show the Jamaican people how good they are, and then we build on it from there.
All right, good.
Hear what has been torn down, but we will catch up.
All right, later, fam. Later. I'm out. Bless.
All right, good.
Yeah, man. Son of Cabinet Minister, Dr. Dawes, that, you know, Alfred Dawes. Real doctor, you know. Real doctor, yes. Real doctor. Real doctor. Real surgeon. Real doctor. Yes. Surgical. All right. So, on the ear now, you know, the whole thing tear down. It mash up. It's not good. I just the ribbon cutting like what we say. You know, we learn this a ball out, you know, and, you know, we just talk as is. You know, Tufton, you know, you watch me and you must have said, boy, the one lonesome can knock me when I'm ready. Yes. Because remember, you know, we are talking about what people them. We are talking about what people them. And we are saying, no, use a man with you do a little spin. Saying? Yes. But if you tell him the truth, you know. You tell him the truth. You understand? Tufton, when you talk to Tufton, Tufton is a person where you can move with, you know. But you see that the work we have, I'm alright otherwise, you know. But the work is not alright in the work. No! Him can't manage this work. And you have to tell him the truth. You know, him there shake him head and say, why you load so. But that's true. Remember, me not go around this and me not play hypocrite role in a tough time. I tell you the truth, you know. You mash up the place, brother. You heard people, you mash up the place. By doing the PR, you look on the depth of the thing there. And you do PR, brother, and mash up the place. And that's the truth. That's how it go. Eh? Where say shaggy money, that gone too. That gone. Here the woman how she spend the money and you want to her mother. Yeah.
For Saturday morning. The nurse said, Miss, There's only 2 pills left, 2 imodipine left. Mister, what you mean? 2 pills left. We bought a week's supply for $95,000.
Imodipine?
Miss, there's no pill. Mister, what you mean? Say there's no pill. Mister, the pill can't last. Mister, want to find the pill. Then last, me mother pill, you know. Or to me, then teeth me mother medication, you know. Mister, what you mean? Say the pill last. Mister, on the search, I gave the nurse the pill for 1 week supply. Every 4 hours, 60 milligrams. You remember that pill that we paid $95,000 for?
No. 1 week supply. Remember, your mother have to live on a pill there. Can't sign up there now. 1 week supply when I buy 95,000. Yeah? Much for 1 month supply. 95, kick it in a 4, 380,000. 4 week supply. 4 week supply, 380. I'm lot of beans, you say? For them money there? It's impossible. That's a joke. That's a blood pressure medication. 95,000 for 1 week. We bought, no sir. They come like, I wonder if we can help out some people with them things. For help out some people with them things, and I wonder if we can circle get something, talk to some doctor, get something like this or something, eh? I used to say for 95,000 for 1 week. Eh? This sounds sickening. So if you've got to live on this year, you know, see how much money that? 5 mg, right? 5 mg. But much you say 60? 4 of them? What's that 60 mg? I don't know. So them have that in a 60? 4 of them? That mean them they are coming out. That mean them are coming at 15 mg. Them coming at 15 mg to baby girl, reggae girl. Have a look. Never go look. Continue.
Eh? Then say, all right, we're going to search, we're going to investigate who was on duty. We describe the person. Then say, call nurses, supervisor, officer and report the case that the pill is lost. Or, in this case, stolen or thief. When we call nurses, supervisor office at Falmouth Hospital about 8:30 in the night, because after visiting hours, someone tell me say she only have 2 pills, and 2 pills is 1 dose because one of the pills is 30 milligrams. So that means if it's every 4 hours, you know, Jamaica, she would miss at least 3 doses over the course of the night, and they already delay her. You understand me? She would miss 3 doses. Me say no, this I get from bad to worse. Me say no. Me say this too much. This too much for the family now. This too much. Anyhow, because me like follow protocol. Me call nurses' quarters and report the situation. Ma'am, you call at a bad time. I say, excuse me? Excuse me? That is at about 8:30 tonight. Me say, I'm telling you that the hospital couldn't provide the pill to treat my mother at first. We bought it for $95,000. Give it to the hospital. The hospital lost the pill. And me I report it and you tell me so me call at a bad time in Jamaica. Well, I heard of the matter. We are investigating it. Okay. But there's nothing that we can do at this time. I say, what you mean? I say, tell me. I say, want you tell me, say, you know, go provide the pill. At least get the night supply until it's search and find. You go, miss, well, sorry. We can't do nothing about that. You have to come back in the morning. I say, but what is? So, of course, you don't know. I have to go back to hospital Monday night. And I have the video and I go release the video where me talk to the nurse. You understand me? So, I say, only if you lost me mother pill. Them don't know who put you. I say, don't you have a pill tray to put pill for that people get to treat them family members? Eh?
Yes.
Miss, we don't know. So what go on tonight? We don't know. Then treat people life like garbage at Falmouth Hospital and the whole medical system. You understand me? When she went to Kingston, so we got the ambulance to take her to Kingston. She got to Kingston Wednesday at UWI Hospital. UWI can't believe. They said, when they admit your mother, Mr. Saturday morning, 5:15, UWI cannot understand. The doctors up there, the team, the neurosurgeon team, can't understand how they have her so long and never ship her off. They can't understand. When she reached out town, it's too late. My mother lungs start collapse, her heart start collapse. My mother dead. My mother dead. Dead. You understand me? Because of the heap of delay and back and forth. And I want this to blast. I want everybody to learn about this. Me not eat. First you go in the hospital, me can't eat. You understand me? My mother dead. Died. Friday after 12. Or if you want to call it Saturday morning. Because when Kingston get her to perform surgery, they couldn't do it. Everything start to fail. And she go in the hospital for Saturday. Tell me now, Jamaica, what kind of health system this in 2024? This must blast. This must blast because it could be your family member.
True.
It could be a long time. Me go hospital and then short a bed and me wallet, but this gone too far. All I keep hearing in my head, my mother they cry and say me head, take coffee. And that doctor Wilkins at Falmouth go say, Mom, you have to wait. See there? You have to wait. She dead. She dead now. And she could have gotten help, but because of the neglect, no machine at their Falmouth. You hear me? Wanna blast this to me. Wanna blast this to me. Wanna blast this to me. This medical system kill off the mother. Kill off the mother.
Tell us a death or death. And I may have said the man drop off a chair, you know. When those sleeping people sleep and go. Them do, you know, when Tufton them come and walk and cut something and say, we spend the most money, people. And Dr. Alfred does right. You can come boast and cut something, but them do is PR. You know, and they have that big mama them, you know. Doing they're the best and they're still doing what? We are dealing with life. We are dealing with reality. We know another foolishness. Don't come cut no ribbon. We don't want to see no ribbon cut. At the hospital, them you put them to make sure it run right. Not forget 85 million to market me and come say you spend 140 billion. And I tell you, refurbish a building. With no hospital, no medication, no nothing, no that you owe. The hospital them owe much money outside, it don't make no sense. Yeah. You understand? I'm Lada P. Brand name Novask. Yeah. And somebody just said them up. So yeah. It's a marvel. Enough people eat for 1 week. 95 hours. Some people if them could have get them there. A doctor right there could have get them to don't know if that could have worked. You know, go back to some doctor and them get, but again, if you could have, if the doctor them could have passed that and you could have get, you know, one of them doctor places, you know, them hand it out, maybe them have sell it. Okay, if you have month supply it, them not gonna sell it and make a money, man. Yeah. But some people need it now and can't get it. It's alright for because them are just there expire and fling them out, not true. Eh? Aye. I tell you, man. That's us there, eh? Jack, it's wicked, you know. It's wicked, man. So when them man come and yeah. We say them sell it. Bam, them sell it. The people them say them sell it to backside. So but you want doctor, you see that go do. You have to find out who need it. And then you make the doctor them, you know, you try to get it down there. and tell them you get it from overseas and get it to them that them get them right dose. If I 10 you have a 5 and get it to the people them who can get help. The ministry must can help you. You see? We ever give them it at $95 for us 1 week, 95,000. That are more than $500. It's like nearly 600. Can you imagine you now work them money there? You know it's wicked. 15 to look how hey, look on this now. Oh, you survive. Oh, you survive in Jamaica. See, everybody say they sell it to backside, them know say it's a criminal government. You look at look at. Eh? Yeah, man. No people have flying and carry it in. See? But the on a serious note, see there? It's expensive, so man I said it. See there? But we save a life. And I eat them right up with the people then. You know, you can, oh, you have to survive. If, look here now. $15,000 for minimum wage. $15,000. But you're a week when you work and no use nothing out of it. 15,000, you still want $75,000. 75,000 for make up your 1 week. So if you know have high blood pressure and you trouble bad and thing and you go work a minimum wage. Yeah? And you just get the money. Remember, you know, you still have to take bus and everything and eat food. But the money that what you get now. Look much week you have to work for it. You have to work 6 weeks for just this alone. 6 weeks for that alone. 6 for 1 week supply. You have to work a month and a half and not spend no money, no use nothing to buy 1 week supply of the same medication for your high blood pressure. And you tell me if that's the country that good too. Don't be no fool, man. No sick or something when you're gone. Oh, the medication not third world country, so I think they might get some subsidy or something or whatever. Oh, them money that's so high. You don't have to buy the brand and you must can come in with something else then. Because this bad. You don't eat, you don't spend the money out of it and you can't buy. You have to work 6 weeks for buy. For just, 6 weeks you have to work for just 1 week. So you have to work 24 weeks. You have to work 6 weeks, 4, 6, 24, right? 24 weeks. Remember 52 in a year, you know. 24 weeks. Yeah? Can't forget 1 month. Forget 4 weeks. You have to work 24. You have to work 48. Forget 8 weeks. And 8 weeks, 8 weeks are really cover. 2 months really cover nearly 9 weeks. See? It used to free Brand Jamaica. It used to free. So when it's a free education and free this and then all this come and say mash up and them do all kind of little things, them yeah, treat the people them. Them for stop it. And that's the truth. See? Enough people not think about this. Look here, wanna look on this now. Look on this and mash up on the head now. For the one of these people, look on this.
Hello, I'm Jovan Johnson. Jamaica's Health and Wellness Minister Dr. Christopher Tufton has been rated the best performing cabinet minister.
You hear what them rate him down there? Hear this. Hear it again. Not my word. After this, I get travel advisory, you know, but yeah.
Hello, I'm Jovan Johnson. Jamaica's Health and Wellness Minister Dr. Christopher Tufton has been rated the best performing cabinet minister, while his colleague, National Security Minister Dr. Horace Chang, has been ranked the worst.
You hear this? Yes. So these are what them do, PR. Remember when them come out with this, my bonnet, you know. This is before the travel advisory, you know. I mean, the wilderness about him, you know. About the garbage, you know. Till one of them people come out more and more all over the place. You rate a man like this, you know what them do? Let me tell you how them get this. Because them bogus. Let me tell you how them get this. Them go out a road. Eh? This I get everybody mad right now. Tough that. You know you watch press alone, so you just get everybody mad. This if you follow them media house and them shit with them do, it run into shambles. Because this not real. Eh? You know real. So them come out with this. Them say about the verse. The verse, but Tufton now 0-2. So them come out with this. So them rate him the best. Or you get the ratings, them go out and them do the poll. You talk to somebody halfway tree or maybe downtown and thing, them at the hospital. If you really want to get the rating of this, you talk to a member with them family inside of the hospital when them go look upon him and come out back. And then you take a poll from all the hospital. 20 of them, you go there, I make them go in, you ask somebody, them go look for them people in there. And when them come out, I try to poll in for them hospital. You don't do hospital at halfway tree and some place when nobody them they're sick. And the man say, well, you know what the man say? Yes. And the poll man, but you what the man say? You what the man say now? Because all them do that poll, I can't do something like for voting. A PR them a look pan. That's why we do PE. Public education we do right now. Yes. If you go to them, you get a wrong poll. Because the man say, well, him them seen or cut the ribbon. Why you think them cut the ribbon and do these things? It's effective. It's effective. Every now people like we are point thoughts and this is bullshit. You understand? It's effective. Yeah, because what them do, them just go to some other little people and talk to them. And for years them have them until we are about them straight and then America come show them and everything done. And America come put out the thing and say, listen, you rate you as number one, me I tell you, you rate a man for number one. And then you get a travel advisor, all that look on you.
Yeah.
Look how this look. You rate him for number one and you get this.
About the poor state of a country's public health care system. As you'll hear in this report, the minister is renewing his call for the implementation of tax, which he believes can help to fix the problem.
The healthcare ministry says the recent U.S. travel advisory has created a negative impact on the country's health system on the international scene. The advisory.
So people, him said it create a negative impact on international scene. No, him create a negative impact for just mashing up the place and go cut 2 ribbon and go up and pulpit and preach and say, him do the most thing, him. We do the most, we this, like what Andrew do. So, you know, people run with them foolishness. Meanwhile, the whole hospital crumble, it mash up. You know, I'm none. I call them mad. When remember, you know, go look at some of the thing 2 years or 3 years ago. When I tell them, say, yo, one nurse, one of them did say them work at KPH, and I tell me, say, me attack and me before wait when I come down to the hospital. And I say, listen me, not even my vehicle, moon park, not even my vehicle, because I get germs. I'm serious. Me want to park my vehicle on one of the ward. They give me vehicle germs. I forgot, you know, sanitize it, don't do all kind of shit. Because I couldn't touch that again. You understand? You have to have one of them car wash where you drive now, and you have to sanitize it down properly. I mean, I go drive back that for now. You have to continue to sanitize it for 6 months before I drive it back. Best set of sanitizers too. Saying, them down in the hospital, them down mag. I'm going to tell them, I'm in a business.
Advisory issued on Tuesday urged U.S. citizens to reconsider travel to Jamaica due to crime and medical services. Americans were told that emergency services and hospital care vary throughout Jamaica, and response times and quality of care may vary from U.S. standards. The U.S. government says public hospitals in Jamaica are under-resourced and cannot always provide high-level or specialized care. Health Minister Dr. Christopher Tufton says the issues in the health sector cannot be looked at in a silo.
The issue is a lot more complex than it.
Nothing can complex. I'm telling you this. All them talk that up here again. If you have a house I run it and it's dirty, your kitchen, your plate, them now wash up. What you do? You know, I'm not soap for wash the plate. The more you wash them, rinse them under the pipe and put, you get germs. So don't you gotta get the soap and you gotta get the scour and thing, the scour your pot them and thing and clean up your place. If you don't have the broom for sweep out your house and in the dirty, and you don't have no map and you don't have nothing, wait, how you gotta do? Use your hand, not go clean. You not gonna buy the right thing them for use on it. It make any difference from the hospital? If you don't have no medication, you don't have no bed, you don't have no medication, you don't have no ambulance. What the doctor them are gonna use and work with? No CT scan, the MRI now work. No, not at all. No in there. What am I do? Go into the building and pose and you paint it up and then cut a ribbon and pose up and say yes. You're good? So me look for the outside of the ribbon, the building and say yes, and you cut a ribbon on it. Put a big ribbon on it and cut it. And then me run up and down and say that good. You take people for idiot. This is how people them get tricked all the way. Tufton, go outside. Go outside. Go outside, brother. Yes. This is how people them get tricked all the way. We see our people them buy a car. Let me just go to something and show you how people them think. And when them buy a car, right now in Jamaica, they buy it by the mileage. Majority, you have some of them will educate themselves about car now, them that know the mileage. But majority, if you sell them a car, the engine not good. All garbage. 300,000 miles upon the car. And you can't sell them as long as you put a new upholstery in there. And just pure the engine and just wax it out. Don't make it look good. I'm around it out. Make it look good, clean. And the man who come by it, him now, boy, he don't look good. Remember the gas stick, not good in it, you know. He might pay you. He made the ear, now watch it here, him look in the clean. He don't know about car, you know. You understand? He don't know about car. So buy the car to how it look. Yeah? Then buy it to how it look clean. Boy, the leather seat, it look crisp, man, in the crisp. Look at the wood. It crisp. Look in there. Boy, it crisp, man, in the dirty, man. Me look on the top, man. Yeah, man, ready. How much this? Yeah, I'm ready for buy it. And as you buy it all 2 days when you look now, head gas stick, head gas stick. The engine not good. Give money and sign up and people then go about them business. You don't know about car. I saw the people them know you have criminal government where through them don't know what to look for. Right? So criminal government know them do PR and just own this on them team. So them go around and cut. Them go around and cut ribbon, paint up a place, then them talk, we are gonna do this, we are gonna fix this, we do the most. And though you live with them at all, but you live through the whole thing and you say everything gone up on your cost of living. You say you don't have no hospital, you say you don't have no road. Then you come and patch through the thing and say, we build the most road. Because when them say that, they must say, you now move for us see what we build or not. So over west, now come at east. So if you say, we build the most road, looking at Kingston, who the west, but that's why we don't get work, but the man them say them building. So me live in West Kingston, me not really go east, I not go north, I not go down south. Me just say, right, my place not fix it, but maybe the east and the west and the north. Some of them soon fix me because the big man said fix. Not fix. You do up at north and you say, well, maybe they fixing it because I not go down west and I not go east and I not go south. And I want vice versa. Nothing no fix, nothing no move. A man come paint up something and cut a ribbon, you will see it on TV. The perception when put in your head, yes man, them a work. Work them backside, you know, say Andrew them cut the most ribbon, boy, man. Them cut the most ribbon. PR. Bullshit. Then them have the local media where them buy out and I watch them and say, watch me and them, watch man, you see it? And the man in the wilderness this. And I see it, people, you know, if I want to just catch an eye, you know. See? And the man in the wilderness, move the eagle. And we have the eagle double whammy. See that the man in the wilderness start. Them can't trick around you. See? We can't afford for them trick people no more. It will stop. Not true. Them have to stop. This is pure foolishness. Our people, them are dead, boy. Our people, them. Goddamn disgrace. It's a goddamn disgrace, a goddamn shame. Yeah? People are dead like fly. When them go in there saying, I need, you know, if you come out. Saying, yeah, man, them are money more than squirrel. It have to stop. So when Andrew them come from bad fee now, so when start there now, is an extra tap here, this when them need to stop. Look here.
Ah, 4 runs. 4 through the covers.
Man, go ahead. Unem just want to get it. Look here. Watch it. Watch out.
Give it now.
So him come now, is the next betrayal, listen now. So him start, him see Marky G with this, you know. Saying, so him come out now when I try to betray the people him again. And I give it, so him come now, I want to play with you because I vote him and look. You know, realize that. When I hear that, the other day him just say, what, madam? Man, there's a man I walk on with the much security guard and when look, him have more than 10 police station have the amount of unit with him, the expensive unit them. And mark police vehicle and some don't have one. We serve 20 and 22 district. Yeah, not even one. Yeah? Yeah. I'm Marky G, my follow, man. But Marky G play cricket for real. I follow him, I follow no way. Jane? Saying, him a follow. Pick up yourself up. Saying, him a follow. For a long time I show hey people, when they just come comedy, you know. The health system when me about feed phone, you know. Me know them sit down and say, him a point it out. Me know my wilderness a point it out. Then US come down and show him this and him say, oh, you know, it's more complicated. In that try defend, you can't defend me, you can't defend, brother. Same know that now I know see them as a boy it look bad for we know internationally. Look how long me I tell him to fix it. Yeah? Him not care about people, man. Them not care about people. That for sure say we not do tabloid, you know. We lock on pan Tufton them, you know. I'm sure that say them I do PR. And US come talk and it go down them tourist arrival and everything because them our US, the most tourists in the tourist industry come from the US. You can go Google it, go and check it. Most of them come from there, so. And at 50, him say, you know. Him say 50, man, him go up at 50 after 30, him go at 50. And I'm a gunman too, man. I'm a punk. Gunman that too, man. See? 50, him go at 50, man. Believe it or not, him go up and push to 50. See? So is the man now, we just come take it now, the little girl. Come drop out. I think the baby did you say them do them best now for make sure the baby, you know, Tufton them. But if can you imagine them spend the market me money and other money? And if they spend 140 billion in the sector, man, that is that good. Is that good? 50 say, man. Yes. And say Andrew for be the richest man. He's the richest man, of course, in Jamaica. Yeah, Andrew. Yeah, man. Ask Andrew. Andrew knows him the richest man, man. Yeah, man. Andrew and his wife. Yes. The richest set of people right now. And then when him can't take something no more. But him thinks that Jamaica be brainwashed same way, you know. Him a brainwash them for a long time. And nobody now can. You with them, alright, hear them plan. Let me tell you them, I tell you up front what them plan. Yeah, you see like how we in here so now, them can't move. What we're gonna do? Them people, them hungry. Them love money. So what we're gonna do? We can buy them out at any time. Any election we buy them out. So we're good. Give them the work, give them some good work. We continue upon the path. We're safe. That them plan for doing, you know. Show monkey wrench in them plan. This is the next part of public. Let me show that one here. And then let me show that one here.
See that? Place one fix, drop down on the elderly man and bed.
Alright, look in our see. Alright. See them cut them thing with them a cut. Look on this now. Looking at KPH. Just look. It drop down, you know, but look on the surrounding.
Need repair.
Nice ceiling.
condition is really terrible. See there? Nearly killed the whole elderly man in bed. See there? Water system, roof, don't look good. Need adjustment.
What a place, big dirty and nasty, man. This a call ward. You wanna ask me now. Now finish play.
I need to step in and do something where this is concerned. See there? Need to be arranged.
So Tufton I do a good job. Jacko. What them say with Tufton now? What them say him the best performer. See a bucket, the thing I catch water there, you know. Kingston Public that were flood. Yes. You see me I say? Yeah man, Bridget, how you mean? Kingston Public this were flood. Just do a little part and then cut a ribbon and chat shit. PR. The government full of PR, then they know we do the most. They don't do nothing at all. Me just show me one thing. So for them to know, I know some things. I'm about to force him to come fix the road. And the force we are forcing him to come fix the road, they want to use it for road. Remember when they do it with Centre Mass Road, that not good none at all. Listen me. You see when that turn 1 and 2, the amount of problem you have to fix back the whole road. Can the patching come like a sore foot now? Now nobody, you know. That have to fix Papa. Yeah. You see me I say, yeah man. It's bad man. You understand? We say, Bevan, you don't say no more. But this is government, what them doing, they might come and friend you up. Hope should make them buy a road. Yeah. Hope should make them buy a road. Saying? Yeah, man. Yeah, man. Control, big up yourself. Saying? Don't make them buy out, lady. Saying? Don't make them buy out. But you know, you just turn an advocate for things like this now. Them things you move you and tap to your daughter. Just follow what I say, turn an advocate for this. You know, put it down. Like no 6 months and thing. See? My fighting about you, my fight when me fight. Me I come from Texas, 98. And me and Mama Andrew out at the back, 1998. And me hear them when them a shoot a fire shot. My brother them a kill them. And you see, remember, you know, in the 80s when me the house, I tell you 88. Me the house stop, I fix house stop, and police take me off house stop. Me, I have an ex-sibling on the house stop, you know, and two other youth on me. And yeah, remember the people they must have leave empty, you know. Anything can fall and wait up in them because you know you take off the whole of them there, put on back plate up. I remember them I tell me about come look for them and I forgot on my liar, them carry them about them I check out. You check out people who were see, but in the 90s now you have to turn up the thing. So me a man a bad for them long time and you see, me have to bear my brother. So you have to turn advocate for where you stand up and where you believe in, man. So you see this happen to your daughter now, you know what happen to other people. So you have to come out there and not make them buy you out neither. You have to stand for your purpose, you know. Yeah, man. Yeah, man. We say so much madness by this man. Okay. When I call Prime Minister, okay, Bevan. See? So this is how it bad. This is how it bad. It's bad, man. It's terrible. See? So you have to turn advocate for you know, for your purpose. Where you know, say, me that to them say, hey, this a go on, this one, that a go on, and you have some little guys, you know, where them join an organization and them feel say, you know, them are running. Them all call themselves veteran. The police force, them all got this bully go. You know where them call soldier veteran? Because like them that go and call themselves a country, now you defend your country, but not pump your country. You go outside, you go fight enemy outside, and them call them veteran that, and them call not police, not teacher, not, you understand? But the soldier them. But go out there. Me not talk for deal with them own people. You understand? Yes, no. So, you know, when you do a work, everybody serve. I'm going to edify them to that. Because some man, boy, me serve and me get rid of this. And me clean up my beer. My beer clean up too now. My beer worse. And then them drop state of emergency and Jojo, everything in and out. But beside the come and I say, my beer clean up. Yeah, them chat too much garbage, you know. The doctor crap them down there and everything because my beer go on. It's a murder capital. Man say they clean up my beer. And then you can't have police when you go to turn police in a cocaine trade and all kind of things, you know. And say you clean up place, you know. You have to go away, you know. You have to go to prison. You can't have criminal with bat and gun and say, but you are good police and you clean up this. You now brainwash somebody and put the blink over them eye. You understand? Go to Cayman's Park, go check who wear blinkers. Don't come here so with it. Move. Everybody contribute from you, get up and you work. That's the teacher, yes, the same police, the civil servant workers, even the private sector workers, them too. Even them. Because things regulated and run, like the bank, the cashier, them contribute to nation building. Somebody come and say, we serve Jamaica. You're fucking idiot. You can't go alone. People have built up the place where you have also sleeping and them thing there. And doctor go on your heart bad and them have fixed and them thing. The teacher teach you. Then you never know say everybody contribute. You're fucking baboon. What happened to you now? Don't come and chat fuck around here, man. Stop it now, man. Go look who serve in our country. I mean, I can continue to show that to you, know. Come in, I want to hear that no more from them and them piece of shit. You do carpenter mason work, you serve the country, the driver, even when you drive private car because of the public you carry, you serve. Whether 10 or 20 years or where you drive taxi, farm bus. All of these are serving the country. You've been in the country. The man who carry garbage him serve. You understand? The same security guard them serve. Because you might run a bank, but the bank has served the nation. The telephone company, them do all of these serve. I play it, you know, make them hear. Because it's coming like happy. Edify your people, them for more than that. So I'm going to start playing it more. I make them stop this shit about veteran and we and this. Can you imagine a man who go up on a light post, them man will clear wire. Every day we get up, him life in a danger. Anybody life in a danger, you know. As long as gun run you, whether it come from police and bad boy, you don't know if police are criminal with bad and gun, him head can kick off and him shoot at the same time. Say life in danger, don't make nobody trick you. Every single Jamaican life in danger every day, as long as you see a man with a gun, whether police or a bad man. If you drive a motor vehicle, your life in a danger every day. You don't know when something get out of control and running at you. A plane can jump out of the sky anytime, you know. The fishermen them serve shark in them out there, you know. And you ever saltwater crocodile, them go out to deep sea, go fishing, you know. And I come back even when you reach certain place and I like your boat can capsize. Eh? You breathe in the water, leave that to Big Mama them and Queenie. You can't breathe underwater. Take a long tongue them and bug life them. Leave that to them, them breathe anyway. See? The life in a danger. The man them are clean the light wire there. We are clean it or we go catch it. We are talking, man. Yeah? Them man they can get electrocuted anytime. See? So man talk about no vision, your distance, stop on a foolishness and edify on yourself, man. Edify on yourself and stop chat foolishness. Time for that done now. Too much foolishness. Depend too much foolishness now, man. See who this about me. Until you see a thing looking like spam, you know, me nobody answer it, you know. And some little fool people come call and I forgot to run them off on my phone. Yes. See? They must edify themselves. And just 1 minute me have some of them, anytime I come on later, I start playing more and more and I show them who serve. And stop talk foolishness. See? You get up and you serve a man will isolate themselves and depend on be a veteran. To do what? You're doing a job. And you do a job in other thing you tell me. That's why the big boy them get to in Jamaica because them feel they must touch them. Call them big. You can't call them name in a court, no care what them do. You can't hold them in a speed, nothing. Big now show you. If you must speed and you do this about to you like Louis. The police living in throw him in a garbage jeep, him try to ticket me. We done with him. The whole of we write him off. Them thing they are sin. It's like you jam up. And you will know right. If you did young and I do wrong, you know, and you get old and you do the right. And you leave in an organization. Nobody feels it, oh, you, them gratitude that you can do anything and them for leave you because you have the veteran on your backside, you feel go away. The man them when them call veteran, most of them come with one foot and one eye and shots talking at them. After war, me attack fire tank and some big missile and bomber drop. You see that in Jamaica. And even them, when them go back to US, you know, enough of them get, we are talking about all of them army clothes. You can't break law. Sometimes them accuse them and do whatever. Why people take up these things on their head? You have to tell them, go edify on the side before the chatting. Can I not chat no shit around and then me run with it? We're not doing it. You understand? Edify on yourself. Alright. But there are no people. Later come have a million things to do. We jump out late, so later me there here. I'm up, man in the wilderness. Keep it with a nice one, you know, tabloid. Bless up.
We in lump sum, we a beat it till the hammer burn. We now make them get in a them and again. None of them boy, we none of them. We in lump sum, we a beat it till the hammer burn. We now make them get in a them and again. None of them boy, we none of them. We alone some rise up the bomber do.
I'm not up, not a Judas, them a backstabber. I'm my wife, and this straight beauty and glamour. No guy can walk to near me with no dagger. Me the heart of Mandela, but the mind of a Zama in the mold. Like a bull man, we send us the jammer. Lyrically inclined, be a metaphor, so no listen to lyrics line to line. Become a lyrical fighter, put up in the rhythm, deal with some boy, all in a hater. Lyrically inclined.